Welcome back. Well, yes, indeed, we will be focusing on that COVID-19, the status in Nigeria, what is being done, what should be done, when do we get out of the woods. But just so you remember that on the 27th of February this year, a 44-year-old Italian citizen was diagnosed of COVID-19 in Lagos.
And on the 8th of March 2020, 40 asymptomatic contacts to the index case and in supervised self-isolation were tested. One of the contacts in Ogun State was confirmed positive.
But March was a pretty busy one. The 30-year-old Nigerian national was diagnosed of COVID-19 in Lagos.
And on the 18th, 5 confirmed cases were announced.
But then on the 19th, you had 4 new cases announced.
10 on the 20th.
Then on the 22nd, 8 new cases confirmed, and yes, that was recorded in Nigeria at the time as well.
It's been very, very, just as you said, a very busy month of March indeed.
Yeah, so let's get some fresh perspective now. The number has since jumped ever since then, but yes, you could see some more info right there. But we're now joined by Dr. Chikwe Ihekwazu, who is the Director General of the Nigeria Center for Disease Control, that's the NCDC. Good morning and thank you for joining us today. It is...
Good morning.
Yeah, so last time we checked, from your messages, 30 cases in Nigeria. Has anything changed ever since? What do we have at the moment?
Well, thank you and good morning, Nigerians. We still have 30 cases, but we will be reporting more cases later today. So definitely there will be more cases reported, and we have to brace ourselves for an evolving situation over the next few days as we work very hard to get the situation under control.
How many are we likely looking forward to today?
Yeah, I can't be specific on that. This morning, gathering the information. Like, you know, we have testing sites in 5 locations in Nigeria. We have moved from a daily briefing to a real-time release of this information as soon as we get it, so that there's no delay. So as soon as we have the information together, this is very sensitive information and we can't afford to get it wrong. We will release that on our website and our Twitter handles simultaneously with the Twitter handle of the Honorable Minister of Health to keep Nigerians informed so that we can all make the decision that we need to make, both as government, as a people, to prevent as much as possible the spread of this virus in Nigeria.
We understand from last week that there are 1,300 contacts that were being traced. How many of them have we been able to get across to? How many are in self-isolation? How many are in quarantine, if you can afford to give us those figures?
Yeah, I think that's an important point to make. The primary containment strategy at the moment is to identify all cases as quickly as possible, bring them into treatment centers, list all their contacts, follow up all their contacts every day for 14 days. We have a large number of people working very hard on this, but like you can see, every day we add more cases. You add another, sometimes 100 contacts to the list, sometimes 50, sometimes 30. So it's a really rapidly evolving situation, and we've had to scale our workforce doing this severally over the last few days. So I can't offer you exact numbers right now, but rest assured that we are working extremely hard to identify all these contacts, list them, and follow them up. This is not an easy exercise in a city like Lagos, where we have most of our cases. 22 of the 30 cases we have are in Lagos. Each of these cases would have a significant contact list, and we have to follow each of those contacts. So this is very difficult, diligent work because people have to go out to all of them, see them where possible, else phone them up and make sure that they're well. If they're unwell, we give them a thermometer, we give them instructions on what to do, and if they are unwell, then a number to call. This is really the primary containment strategy: early detection of cases, early listing of contacts, and close follow-up of all of those contacts. But allow me one extra statement. Yes, we're following up on all the contacts, and really that we've identified a handful of cases from those contacts. Our biggest source of risk at the moment are from people returning to Nigeria from countries that have a large burden of infection. Most of these are Nigerians. There's nothing wrong with coming back to your country, but we are asking every Nigerian that has come back to Nigeria that to please do what we've asked you to do. Stay at home for 2 weeks. If you've come back to Nigeria from any of the countries where there's a significant burden, we've classified it as over 1,000, but really any country where right now we say once you come back from any country, stay at home for 2 weeks. And we're not just asking them, we're asking your friends and family to help us with this. If you're husband or wife to someone that has come back, or father or mother to someone that has come back, it is your responsibility to insist that this happen. If it's your friend, insist that this happens. If then that person becomes symptomatic, has cough, cold, a fever, please let us know. You can save us a lot of work by doing this. We cannot police everyone that has come back from anywhere in the world, so we need society to join us in this effort. As we progress, we have to work together. And this is our biggest source of risk at the moment. They're not the contacts. They are important, yes, but most new cases that we're finding are being reported in Nigerians that have come back from countries of a significant burden of infection.
So supervised self-isolation, it's a challenge, but do you have an idea of how many people have called the emergency centers or NCDC and how many are under self-isolation? Because there are those who think that these cases before the end of today may increase by a factor of 10.
Yeah, thanks. Firstly, the cases will increase. A factor of 10 is unlikely. So let me put that to rest first. Secondly, we have a list of everyone that has come back that's on his form, and from the information we have, has come back from one of these countries. People follow up on them every day. But that list is increasing exponentially because since the number of countries with over 1,000 cases has increased a lot. So there's simply, at some point, it becomes difficult to follow up on every single person from here. So my point today is, please, let's not leave this for government. Let's not wait for someone to call. We all know the right thing to do. We don't need to police everyone self-isolating. We will do our very best. But really, the human resource requirements for the scale of work we are required to do at the moment in the containment phase is incredible because every day the numbers of people coming back is increasing exponentially. And we cannot increase our workforce exponentially. We have to train new people, we have to instruct them, and this is a very hard and diligent process, which we are doing. The whole weekend, everybody in NCDC and everybody across the states in Lagos, Abuja, literally was working 18 to 20 hours a day, both on the response and increasing quickly, rapidly scaling our capacity, i.e. training new people to support the response. But I really don't want Nigerians to wait for that call or wait for someone to police you to do the right thing. We've given out the best practice. We need Nigerians to cooperate with us in your own best interest to work with us to help limit the transmission of this infection.
Can you give us an idea of how busy the NCDC call center is at the moment? Because we also understand that the kind of information that people get when they call it leaves a little more to be desired. You would remember that was it last week or 2 weeks back, someone said that they called the NCDC line, but they didn't get a response in good enough time. Even last week, excuse me, even last week some people were saying that they made efforts to get across to the NCDC, but that the kind of information they were getting from your officers were not as strong and were not as coordinated. 3 different calls to 3 different people. They give 3 different responses to the callers. Could you then educate us what people should be hearing from your people and how this is going to run? Because it would seem like they have a little less training than they need.
Yeah, I did see those circulating, and to be honest, the only thing I can say is, listen, Nigerians, I'm sorry if there have been any missteps. We have scaled our capacity exponentially. We receive thousands, literally thousands of calls per day. And so from a call center that was barely busy, prior to this, maybe we got 3, 4, 5 calls a day max, to literally 3,000 to 5,000 calls per day. And we've scaled the number of numbers. It's still one number, but we've scaled the number of lines that go into that. We've had to train new people over the weekend, again, increasing capacity. So there will be some quality issues. I'd like Nigerians to please bear with us. None of this is what we'd like, but we're working very hard. 90% of those calls are excellent. The team is working very hard. They need your support. They absolutely need the support of Nigerians because they're stretched. They're working hard. We're scaling that capacity. We've had some private sector companies offering support in that specific area. This week, we will be absorbing that support to scale the call center even more. But, the first thing is, please reduce the number of calls if it's not necessary. We get a lot of calls that people can go to our website, get basic information. Stop clogging up the numbers with phone calls you really don't need. There's a lot of information on the NCDC website. Go there, pick it up on what to do. Let's limit the calls to people that really have something important. We are working on our side, absolutely working very hard to improve the quality of the responses, standardize them, make sure everyone is trained. We have incorporated 2 levels of supervision over the weekend, just to make sure this thing that we have been complaining about around the quality is quickly addressed. So yes, we recognize that there were a few lapses, and we're absolutely grateful for those that have pointed it out, sometimes embarrassingly, but we're working hard to improve it. And even if we're not perfect, it will get better over the next few days. So please bear with us and do the best that you can to help us by getting the basic information you need if you don't actually need to call. But yes, the call center will be improved, and we're working extremely hard to do so over the next few days and scale the capacity so we can absorb more calls in real time. We had about 4,000 calls yesterday to NCDC alone, not counting the Lagos number. So it's a huge volume of calls received at the moment.
Correct this now. Did you say we have one emergency call number?
We have one number, but there are several lines feeding into the number. It's a toll-free number. So once you can have a toll-free number and have 16 to 32 to even more lines calling in. So even though it's one number we're sharing, it has the capacity to receive calls from hundreds of people.
Now, yes, we've identified some challenges. We need more. NCDC doesn't have capacity to supervise those who are in self-isolation. So chances are that before they start showing those symptoms in 2 weeks, they might have infected 1 or 2 people. Would you advise that the state governments take more measures, possibly because some states who haven't recorded any cases think, look, it's got nothing to do with us. So they're going about as though it's business as usual. Should we be doing much more than has been done in some states? And those who are not doing anything, who haven't announced any amount of people to work from home, should they be doing something?
So every state, we had a meeting with their excellencies, the governors of all the states in Nigeria at NEC last week. And this entire meeting was really focused on this challenge that the government is facing. And I am absolutely sure that every state governor in the country right now is planning and doing already several steps. And you would have noticed several have announced actions across their states. All the state public health teams are already mobilized. They're working very hard. We are supporting them. So when we get this information, a lot of it is passed to the states, because once people tell us, listen, we've landed in Abuja, but we're going to Enugu, we get the numbers of that individual, we pass it on to the Public Health Department of Enugu State, and they continue the follow-up. Going back to your question, over the weekend, we launched a campaign called Take Responsibility. And this really means that beyond looking at NCDC, both at state government and at individual level, we're urging everyone to take a lot more personal responsibility for their response to this outbreak. you see the biggest area of responsibility right now is by individuals. What can really stop this virus spreading from one to the other are the actions that individuals will take. Once someone comes back to Nigeria, then the risk is in how many people do you transmit if you are infected. That transmission depends on close contact, it depends on hand washing, it depends on whether they go to mass gatherings or not. So it depends on all these decisions that individuals will take. If you're back, you have an invitation for a wedding, do you tell them, sorry, I cannot go? So it is that taking of personal responsibility by people that have come back or may have been in touch with someone else that will prevent transmission of this disease from one to the other. So yes, the federal government, you would have seen increasing actions. It shows we are taking responsibility. State governments are doing the same. And now we're calling for every Nigerian and everybody living in Nigeria to take individual and personal responsibility for what you do. Do you really have to go into work? Can you work from home? Can you avoid that meeting without being unproductive? Do you have to shake that person's hand? Do you have to hug her? All these are decisions that we have to be taken. And many of them are uncomfortable. I admit that. It's hard to meet your friend and not shake hands, not hug, but this is what we're asking Nigerians to do in the short term. Join us in this campaign. Take personal responsibility. Let's see how we can collectively stop the spread of this virus.
And speaking about taking responsibility, Britain, for instance, they say they've identified 1.5 million people who they will be writing to, part of those who are most vulnerable. Now, back home here, would you advise, or why aren't we thinking about those who have underlying medical conditions? Why are we not talking about reaching out to them, asking them to stay or do certain things if they are most vulnerable? For those who have, perhaps, if they've got asthma, high blood pressure, all of those, why aren't we talking about those things here?
We are absolutely talking about them, my brother. We've been sending out these messages before the show, and we'll continue to. Listen, we can't turn our country into the United Kingdom in a week. We don't have a list of everybody aged over 60 at NCDC waiting to send out the letters. Nigerians will understand. We have to deal with the country we have. Our advice has been consistent. The people most at risk are the elderly population with certain comorbidities, heart disease, diabetes, maybe if you have any cancers. So please, for people like that, we can't write letters to everyone in Nigeria, so our advice has to be generic to all of them. And it's the same as to everyone else. It just means it has to be intensified even more. So if you have a parent that you're looking after, it's not just that parent's responsibility, it's also yours to ensure that that individual is well taken care of, is isolated as much as possible, and stopped from having access to lots of people. So whatever we're doing for ourselves, we have to do it even harder for our elderly parents and elderly brothers and sisters, because they are, not that they are more at risk of getting it, but the consequences of their getting it is worse. So the likelihood of an adverse outcome is worse. So we're asking everyone, we can do this. It's not impossible. Look after our parents. There are many circumstances in Nigeria that are different from the West, where a lot of these cases are happening, this spike in cases. We don't have a lot of our elderly living together in care homes, so there is an opportunity. Many of them are in the villages. The most likely, for this particular virus, the most likely area of transmission in the short term is in cities, because most likely this is being introduced by people that can afford to travel. When they come back, most of them end up in the cities. So it is the people that have come back that will take it to the rural areas. So we're asking you, if you have not visited your parents in a few months, please don't decide to go and visit in the village this week. Let us stay in the cities, manage this, avoid going to the villages so we can prevent ourselves from transmitting to the elderly. And those among our parents and the elderly living with us, please, whatever we have said about self-protection, taking responsibility, hand washing, we must even enforce it even more with our parents. And to be honest, that's the most difficult, because we are used to providing them a lot of care and attention, and we can't be prescriptive in the changes that we have to make now, but we're asking every family that is in that circumstance to evaluate their own circumstances and make sure their parents are protected. If they are not visiting, that's great. If they are around, please protect them from the rest of the family and make sure we keep them as safe as possible.
Is it true that those who eventually recover from COVID-19 will suffer 50% of lung damage permanently, which means that they will be on medication forever or may die from complications in a few years after recovery?
So that is absolutely not true. There's absolutely no evidence on that. In fact, right about 80%, and this has been consistent from China to Europe now, have very mild symptoms or no symptoms at all. So 80% of those infected literally recover in few days, just like you'd have a flu-like illness. You get better, you go back to your normal work. The challenge is that that 20% that do get sick is not insignificant when the numbers increase. And you can see that in countries where they've had a big outbreak. But we'd like to also remember that many other countries around the world who have seen infections and haven't seen the large exponential growth that we see in certain countries in Europe at the moment. So our actions can definitely slow the course of this global pandemic in Nigeria. It depends on what we do collectively. So I want to, in terms of your question, please put that to bed. There are no long-term consequences for most of the people that are infected. Maybe there will be a small proportion of people that have a severe illness that may have some consequences later on. It will be a tiny percent, and we really don't know what that is because, nobody has had this. The people that have had this disease the earliest had it 3 months ago. So anyone that tells you they understand the long-term effects of this is simply not being honest with himself or you. So we don't know yet what the consequences are for those that have had a severe illness, but everyone that's had a mild illness, which is 80% of cases, recover fully 100%. We've seen that happen in China. China is down to single digits. Everybody is going back to work. And we've seen a successful response in a huge country. Despite the challenges in Europe, that gives us a lot of hope that there is a way out of this if we work together.
Because that came from a medical practitioner who gave that view and it's also widely circulated. Could you tell us, in states that are affected, how are the private hospitals responding? How ready are those hospitals?
Yeah, so this is an important question. The states most affected at the moment are Lagos and FCT. Lagos by far has the largest burden. All the cases at the moment are managed in a public sector facility. There are expansion possibilities in that facility. The state, with support from the federal government, is working to scale that capacity right now. And so we should have significant more capacity in the public sector in Lagos, both in federal and state institutions, to scale the capacity that we have to manage this. Now, for the private sector, we've started engaging with them in terms of how they can help. This will be a systematic approach. We're meeting in the Federal Ministry of Health today with the Department of Hospital Services to have a plan. So we have a few scenarios at the moment in terms of what to do at different stages. And so at the moment, the best I can say, if you're a private sector practitioner, please be aware of that you may be called on to provide support in certain areas. That will become clear in the next few days as we engage, so nobody is caught by surprise, and we see how we can work together to scale care. Because really, the challenge for our health system and any health system is not that we can't provide care for this illness, because we can. The issue is the numbers. So if we have an exponential increase in numbers that overwhelms the system, then we need to call on all parts of the system to help very quickly. And that is really where the challenge is. So what we're working very hard on is to reduce the number of new infections coming into Nigeria. You would have heard the term flatten the curve. This means, we don't want a large number of cases at the same time. If we can flatten the curve, spread the cases out a little bit more, give ourselves the chance to prepare more and make sure we can provide care and isolate these cases from others, then we have a chance of preventing further transmission. So really, this is what we'll need to do with all care providers. We're looking at hospitals in the public service, public sector, but there's absolutely no way we can manage if we have a lot of cases without the support of the private sector.
Dr. Ekwazu, we need to go to break. We know you have a tough schedule and you need to go, but if you don't mind, just a couple of more minutes. We'll come back and let you conclude your thoughts in just a moment. Please stay with us. All right, welcome back, Dr. Ekwazu. Could you tell us, I mean, states are announcing different measures. People should work from home for at least 2 weeks, others are giving different timelines. Do we have an idea of when we need to turn the corner, or how much time do we need to slow the spread before we can then say, okay, people can get back to at least somewhat normalcy?
So, Chamberlain, how much time it will take to turn the corner depends on us. It absolutely depends on us. So this week is the beginning. So there's no magic bullet to this. There are no quick solutions. We've got to work together. At the federal level, with the presidential task force in place, Mr. President has demonstrated that he's taking this very seriously. I've been in meetings throughout the weekend, last week, with the highest level of colleagues in government, making very hard decisions about huge sections of our economy on what to do and putting the health of Nigerians first. And decisions have been coming out from that level, and there will be more. The state governments are doing the same. Schools have made very hard decisions to stop. We're calling on our religious leaders to follow examples from around the world. It's very difficult, but we really don't have a choice right now. We need your support. States and the federal government have been a bit careful in not imposing this, allowing enough time for consultation with our leaders, our religious and cultural leaders, so that they understand why we're doing this, not just imposing bans. They need to understand, because we need their help to educate people and people that respect them on why this is absolutely necessary. But around the world, we have seen leadership from all the major religions cancelling congregations, and we're calling on all of us in Nigeria to do the same. Whether you're a religious leader, a school principal, state governors, all of us have done this. Let us find alternative means of teaching and praying in the next few weeks as we manage the health circumstance that we have. Without collaboration, coordination, support, and mutual solidarity, we can't get out of this. So this is not an area where we can just impose our rules. We need an all-of-society response in this. And in terms of the time it will take, to turn the corner depends absolutely on what we do now, what we do this week to prevent transmission.
Which also underscores, Doctor, the importance of awareness. It would seem like awareness is very, very sparse these days. You may have caught that report we played earlier, where some people on the streets are saying this whole thing is a hoax. So how far is that going? What collaborations are you having with which agency of government to drive down this awareness further? And that's for those who don't believe that it exists. For those who know that this thing exists, who are taking certain preventive measures, some we understand feel that they are already infected and they are at home taking Amatem. And some we heard last week from the Commissioner for Health in Lagos saying that some people have been brought into the hospital for overdose of chloroquine. What kind of awareness is going out to these categories of people, and by whom? Because it will seem that the awareness is very, very sparse.
Thanks, Ayo. I mean, we have done so much work in the last few months, not just at NCDC. I mean, with almost every government agency responsible that has some role in communications, whether it's NTA, NOA, everyone, FRCN has been airing messages for free to Nigerians. Your media house has carried some. Social media is abuzz with messages. We've given every state a pack of messages, IEC material they can translate to their local languages. So getting people informed and educated on this is a big responsibility for all of us. We've been trying so hard to do this. We need everyone to come together. Yesterday, when we published our Take Responsibility campaign, we asked everyone, whether you're social media, conventional media, whatever you are, to take those messages, translate it yourself to soft video, to languages, to pidgin, to whatever local language you speak. Run with it. So don't wait for NCDC to come and support you with it. Run with these messages. This is real. I want Nigerians to understand. If you don't watch TV, please put on your TV set and watch. This is not a hoax. This is a virus. It's a new virus. It can cause a lot of devastation in any society, as we can see on TV. We are working very hard to prevent this. We understand, and that is why some of the decisions our leaders have had to take have been so difficult. Shutting down a part of society is hard. Many people in the elite think it is easy. Shutting down a city, many people in Nigeria live from day to day. So we need to take all of that into consideration when our leadership is making very hard decisions on what to do. There are no easy decisions on the table at the moment, but they are making these decisions well informed about the risks and the benefits, and they have gone ahead to make this. Now we need to come together and help, but we recognize how hard it is to shut down schools, to shut down public gatherings, to keep people indoors for days. Is not easy. Not everybody can work from home. It's easy for certain people to say, we are going to make a lot of those decisions in government in the next few days, no doubt about that. But we are also aware that it's not an option for many Nigerians. So we have to think about them, make it possible for them to earn a living, while bearing in mind that we have to be alive to make a living in the long run. So there will be some short-term pain in terms of the actions that we have to take to ensure that we're able to stop transmission of this virus from one person to the other. The best way to do this is to stop contact among people, increase the distance, what we call social distancing, 2 arm lengths away from each other, my arm and your arm, and that is an easy way to define how far apart we should be. And this is not an easy thing, but this is what we need to work together, support each other with, in our families, in our homes, in our communities, to make it possible. If we do this well in the short term, the long-term benefit will be incredible. It will be, we will have a victory song to sing, but we need to come together in the next few days and next few weeks as a country.
All right, we've got to let you attend to other matters, even though questions, issues, these things never end. So many issues that need to be addressed, but I guess we'll keep hitting your number. It's an emergency number for us now, so we'll keep hitting them and get across to you much later. Thank you for your time and all the best. All right, so we'll be back and talk about the economy. How are these things affecting your business? Join us again.